My name is Bianca Link. I'm an orthopedic surgeon and I work in the field of LSDs for nearly 9 years now. I started within the department of Professor Beck in Mainz for several years, and then I changed to Switzerland for private reasons and started 2 years ago in the University Children's Hospital in Switzerland, doing more or less the same, managing and doing nearly everything in terms of the musculoskeletal system for patients, not only with MPS, but all lysosomal storage disorders.
Okay. And do you have a specific interest in research, or?
Yeah, well, the musculoskeletal system, it's a big issue nowadays. The children and also some adults are improving with their systemic therapies like ERT, transplantation, but the musculoskeletal system is not really convincing in the benefit they get from therapy. And therefore it's a big issue, because if the patients have a better heart function, they want to walk.
Yes.
And you are dependent on your joints and bones for walking as well. And therefore it's getting more the questions to me what to do.
And you just had your presentation. Can you give us a short summary of your presentation?
First of all, I made just a little introduction that there are several different pathomechanisms to deal with in these patients. On the one side, the ones triggered by the storage itself, and on the other side, the ones which are dependent on mainly gravity forces, tension, pressure, and so on. And then I made a short overview what's happening in the musculoskeletal system, not from the top to the bottom, but in the main regions in different MPS types. You have common features in all types, and you have differences also. And in the end, I discussed several cases just to give some insights how we think, how we try to figure out what's the main problem, and in what kind of complications or problems you can run if you don't see the whole system by dealing with these patients.
Why are you so interested in these kind of diseases? Because it's very specific and not a lot of patients. It's a small population.
In a way, I ran into it by working in the orthopedic department of Mainz. I came into contact with Michael Beck. And the interesting thing is that you have to work in an interdisciplinary approach, and this is not very frequent in orthopedic surgery. Normally you just see the joint or the spine and nothing else. Yes. And that's the kind of thinking and working I like, and especially in these patients you have the whole system to deal with, and you have a lot of different specialities to communicate and to plan what to do.
What do you expect from the weekend?
Well, mainly it's always interesting to see how patients and scientists and doctors are doing in other countries. Yes. And this is a great opportunity just to communicate, to see what others do, and discuss with patients, with other doctors.
Yeah. And how do you like the concept of also on the one hand patients and on the other hand scientists who talk about their research a lot?
I think it's a very good concept. For me it has two different sides. It's important to keep patients informed, and that's a really good platform to do so. Yeah. On the other hand, I made several conferences like that in the past years. On the other hand, I think patients are coming with their big expectations, and then they contact you and you don't have your equipment. You can't really examine or make a reasonable solution for them. And sometimes for me this is a bit frustrating, because you see the patient, you know, if I have him in my hospital I would do this and that, and you can't by staying here. But in general you get into contact, and they can contact me afterwards by mail, by phone, and we can try to figure it out